We're back for our next departmental budget discussion. And before I go any further, I'm David Briley, Mayor. I'm joined by Talia Lomax O'Neill, the city's finance director, and Emily Piscini, the chief of staff here in the mayor's office. I saw Councilman Russ Pulley had joined us in the back, so he is here as well. Before we jump into the budget, even though it doesn't really relate to Metro Action Commission as much as it might to other departments, we did have a hard budget year last year where we couldn't do cost of living adjustments. May not have directly affected MAC as much as other departments, maybe indirectly just as much as any. We've been able to tighten our belt a little bit this year, live within our means, and this year we'll be in a position where with some new revenues we can give a cost of living adjustment to our employees, and as an acknowledgement of their importance to the city and our thankfulness for their hard work. So with that, I will ask Dr. Cynthia Kroom, who is here on behalf of the Metropolitan Action Commission, to introduce herself and her colleagues who are with her, and save a little bit of time. So at the end, we may have some questions, or might want to eat a cookie, perhaps.
Thank you, Mayor. I'm Cynthia Kroom, Executive Director of the Metropolitan Action Commission. And I'll just share, I've had that role now for almost 19 years. That's a long time. So I want to introduce to my left Dr. Lavinia Steele, who is our board chair, and to my right, our Chief Financial Officer, Mr. Robert Wright. Joining us also today as members of our leadership team. Not with us is Dr. Farrah Fondren, who is the Head Start Director, but joining us is Lisa McCready, Marvin Cox, Karen Crook is here with us, and of course Councilman Pulley is a member of our board. He's the council representative to our board. Our HR business partners are interviewing staff today, so they're also not with us. I want to make sure that based on your opening statement when you talked about the adjustments that were made that did not affect our department in the way that it did others, we are largely federally funded, and so many of the adjustments that were made, I know, was made to local money. However, I want to make sure for my team members who are listening who might have panicked when you said that some of that did not apply to us, we look forward to the team of the Metropolitan Action Commission also receiving a 3% across the board increase, as well as the opportunity to receive open range funding. So I wanted to make sure I stated that clearly for the record to make sure that we were on the same page. Thank you. Thank you very much. I should say that because I am really proud to represent the more than 300 team members of the Metropolitan Action Commission and the incredible work that is done on behalf of those who are less fortunate in our city. Mayor, I'd like to begin with a thank you, first of all, for the $3.5 million on last year that went toward our buildings. I know that you have seen at least one of those locations, which is the north location, and you know what kind of very nice, just even on the external part, things were done to help that facility look better, but even more importantly, to address some of the environmental concerns that were there. I want to share with you some good news to go along with that, that as a result of the city's investment, we made a proposal to the Head Start National Head Start Office to have what's called duration funding, which allows us to extend the day for some of our children. But what they did in addition to that was to provide, we just found out, I think on this week or end of last week, Talia will be happy to hear this, $500,000 to our agency, $535,000 to be more exact, for playgrounds for our facilities. In addition to that, some of those dollars are allocated to be used for other equipment that we need. So the city investment has been joined now by some additional dollars with the federal government. I should add to that, Talia, that in the upcoming year, as a part of duration funding, that means, again, we will be able to offer extended services to children in 4 of our locations. We will receive a budget increase of approximately $874,000 of federal dollars to help us with those services for children. That includes being able to have more individuals on team who work with children who have behavioral concerns or other types of disabilities that we don't at this point have the adequate staffing to be able to address. I should also mention additional good news this year that we received from the federal government, passed through the state of Tennessee, for our energy assistance program, which many people are aware of, an increased portion of $12 million. We initially received about $6 million. They extended the year from July 1 for us, and these funds end on September 30th of 2019. We have been working diligently to make sure we can spend down those dollars, and so I want to use this as an opportunity, as an advertisement also, that we have dollars available in our energy assistance program to assist additional customers in our county. Mayor, the fact that you announced an increase in funding to affordable housing is incredible for the people that we serve. But I would be remiss if I didn't mention that it's also important for the people who work for the Metropolitan Action Commission, many of whom also are impacted by the affordability issue in our county. So thank you so much for that announcement and what I know it means to our team members. Continuing with good news, our agency in the last year was recognized not just for the work we do around emergency services, but for the work that we do around 2GEN. And I'll just briefly explain that, Mayor, if it's okay. 2GEN is when you not only work with the children in the Head Start program, but when you also have initiatives that help the parents. Specifically, in our case, we have 2 initiatives that help parents with employment. The ultimate goal of that employment is to help them move out of poverty. One of those initiatives that has received national recognition is our Comptia A+ certification program, which, by the way, is a partnership with Metro IT. So the individuals go through the Comptia training with us. They do a year internship with Metro IT. When they finish that internship, they are qualifying for jobs or getting jobs making $47,000, $48,000, and $50,000 a year. These are parents who are at 100% of poverty when they come into the program and then have an opportunity to have this experience. We were invited by the Kresge Foundation because of that work to present an application to receive funding from them. There were 228 organizations who submitted. We are now in the top 23. We have submitted the final proposal to be in the top 10. If we're in the top 10, they will fund us with an additional $500,000 to continue those supports for parents in the Head Start program. I wanted to, again, make sure I mention that because oftentimes people think about the work we do related to the children or to emergency services with our energy program and the work that we do through rent and mortgage assistance. But very few people know about our work around 2GEN. 2 more things, and then I'll breathe and give you a chance to ask questions. We have 2 research studies that have been funded by the state of Tennessee, who also, because of the work that we do around 2GEN, provided us with an additional $765,000 this year for special projects to work with our families, but also to continue the research that we're doing on a correlational study that we've done over the last 3 years, which shows the outcomes of our children correlated against when we can help their parents get more involved, whether or not those children actually see an improvement in outcomes. Our results clearly show that the children have a greater increase in their cognitive development if their parent is more involved or engaged in training or other activities. As a result of that preliminary research, we were given the $765,000 by the state through our CSBG funding, and we have 2 studies that we are bringing in outside individuals to do on that work that are to be used as national models, both with our community action partnership as well as for the state of Tennessee. I wanted to mention those things because there's been a lot of really good work going on in our organization with our team, and wanted to make sure that we shared that both with you, but also as a congratulations to our staff at the Metropolitan Action Commission for the incredible work they do on behalf of individuals who are less fortunate. We'll take your questions at this time.
Well, that's a lot. But there's one area that you didn't mention, and I guess I was looking for an update on what's going on with the pre-K work.
So be more specific.
Just I know that there was this team of people that were working on lots of recommendations about how to move forward in the city, and I've really lost track.
Okay. So one of the, I think what you're referring to is the Early Childhood Education Committee. And so clearly we lost a large number of the team members who were spearheading that. In the interim, however, we've had some discussions with the United Way about whether or not they would then sort of take over that role of making sure we all continue to meet and advance the agenda together. However, it's important for me to share with you that we're already advancing parts of the agenda. One of the things that was our goal to do was to figure out ways that we could interface with metropolitan schools pre-K. So what you may not be aware of is that during the summer, now for children who have a disability, who might be in Head Start or in pre-K, those children actually receive services now in 2 of our Head Start locations. Last year in the Susan Gray location, this year Susan Gray and Tom Joy. I'm glad you mentioned it because it was also noted at the national level, and the National Director of Head Start, Dr. Bergeron, was here over the summer to look at that partnership between schools and Metro Action Commission to make sure that children who are in the pre-K age were being served over summer in buildings that were conducive for children in that age group. So that's one of the things that we're continuing to do. There are some other pieces that have been put on hold, but the areas that we're able to work together on, we are moving forward with some of those.
Okay, I appreciate that update. That's all I have.
I'm just curious, how many people or families do we serve through the Energy Assistance Program?
So last year we served just over 9,000 households. When you look at the number of individuals that we serve, that number is much higher. However, with a $12 million budget, if you look at what we can do per individual household, that means that we have the ability to serve up to 30,000. And so the outreach efforts that we have been doing have been fairly extensive, working with churches, some of our mosques, other groups, because that is a huge outreach in order to get to that number.
That comes in the way of vouchers or what?
So for the Energy Assistance Program, it's direct pay from us to the energy provider. So there is no actual dollars that go into the hand of the individuals who are coming to us for assistance. They come in, we qualify them through the system that we have, and then we send a voucher to NES or whoever their energy provider is, letting them know that this person is being assisted by our organization, and then we pay NES directly.
That's great.
Okay, I have like 3 or 4 things.
Okay.
And I'll follow up on the energy part. So we did get $1 million grant from TVA to go in and do energy retrofits for low-income individuals on fixed income, basically. So is that information available to folks who are asking for the LIHEAP assistance as well? I mean, is NES doing a good job of reaching out through you to people who are needing the assistance?
I think I'd let Mr. Cox from our Energy Assistance Unit answer that. I do know that from our side that we are making referrals and making individuals available. Is it an opportunity to make additional information available to them? Absolutely. We make 2 referrals to them related to similar things. As you know, the weatherization program is one of them that we make referrals to them for. This one, I don't know that we put as much energy around, but I know we will going forward.
Right, and it's generally, it's going to only apply to the homeowners as well, not to renters and such, and so maybe the number of folks you're dealing with is going to be a lower percentage on that, but it's something that we would like to expand because it helps with affordability overall if we can reduce energy costs. The second thing is, the correlational study that you're talking about, are all of the parents going through the ITS program, or are they going through varying sort of job training programs?
So the correlational study looks at lots of things. One of the things it looks at is the job training. So the Comptia is for a very specific group of parents who have opted into that. They take an assessment for compatibility. There's a number of other things they have to be background checked. So it's a lot that goes into that particular piece. So what the correlational study is also looking at is the amount of time a parent volunteers their time in the classroom with their child. So we correlate the child's outcomes to parent volunteer time. We correlate their outcomes to whether or not the parent has their GED, whether or not they have an associate's degree. We also look at whether or not children who whether children who receive SNAP or other types of benefits are progressing at a different level than children who don't. And so what it allows us to do is to figure out whether or not we need to make adjustments in terms of happening in the classroom with those children as well, if we determine that barriers that Head Start has, that we identify, is impacting the child's learning. So we literally correlate the outcomes of the children against about 60 factors.
One of them is the parents' professional attainment or
That's
advancing
correct.
in their field.
That's correct.
Because I know there have been studies for a long time that loosely correlated a low-income parent's job advancement with more cognitive development for the child. And this is just sort of a deeper dive into
That's
that.
correct.
And so the $765,000. How many parents? What's the group? The number of folks that you're looking at? How many parents? How many kids?
So the 765,000 covers a number of facets of our 2Gen. So, for example, one of the things that it's doing, in addition to the 2 research pieces, it's allowing us to bring in someone to work with our youth over the summer who were a part of our summer youth program 2 years ago and forward. The reason for that is that those are teenagers who are in the house of Head Start families. So you can only be in that if your sibling is in Head Start. Mm-hmm. So what it's allowing us to do is, look, we have the child and the parent, and now we are also trying to look at whether or not the things that we do in the household with other children impact the outcomes for the family as a whole, because the family also has other outcomes. So it's also funding some of the work related to the teenagers that we work with. We have a father-to-father initiative that looks at the involvement of dads, increasing the involvement of dads in the program with their children. So it's giving us additional funding for somebody who's working with our dads, because, again, we're correlating the involvement. If we can increase the involvement of dads into the program, coming to their child's school, reading to their child, will we see an increase in the child's cognitive development? So there's a number of people who are involved based on all of the different factors. So for father to father, we have probably about 100 or so dads in father to father. Comptia may have 20 individuals. We also have the CDA certificate that we do. CDA generally has 20 to 25 parents. And then you have parents who are involved in, we have something called Ready Rosie. I know, it's a lot of names. But it's actually an initiative that sends videos and other information to parents, and then it tracks whether or not they worked with their child on them to see, did that increase the child's outcome. So there are a number of factors and a number of parents depending on, or individuals from their family, depending on what the specific area is. The $765,000 allowed us to provide enhancements to some of the work that we were already doing because we needed additional supports for those initiatives.
And so if the study comes back and identifies, I don't know, 6 or 10 or 30 of the factors being directly related to cognitive improvement or whatever improvement is identified, do you have the resources to scale that up to more families, or is that going to be, is the federal government going to provide those? Is the state going to provide those resources, or are we as a community going to have to identify those resources on our own?
Well, part of what we've been doing is trying to identify some of them on our own, and Kresge is one of those examples. One of the things that's really important right now is not just that you have practice that you do, but that you have research-based practice. And it doesn't even have to necessarily show that the research is succeeding with everything you're trying to do, but at least being able to demonstrate that you are tracking this beyond just your basic anecdotal saying, yes, we're doing this, and it's accomplishing things. So what made us eligible for the Kresge grant is because we are a 2Gen organization. Not many of them exist in the country who are as far along as we are. So we were actually invited by them to participate in this opportunity because of the work that we've done. So we're also one of the, on the national level with our own organizations, community action agencies, we're one of 11 that's a part of what's called a whole family of practice because they need evidence-based work on what we're doing. What it affords us the opportunity to do is to search for other kinds of funding through grants, through foundations, something that we haven't been able to necessarily do as much of before. It lends itself to more of that. We believe that it also lends itself to, again, we're getting duration funding through the federal government. It puts us in a different category in terms of our ability to solicit dollars. Now, since you mentioned the city, and because we know that these things are extremely important, we also believe that our general focus when we're asking the city to do something is to help us take care of our employees. You will rarely see an ask from us that has anything to do with programmatic pieces because we feel like we've been able to do a good job of getting those sources. However, when it comes to the benefits for our staff and the pay for our staff is generally where we ask the city to provide the greatest amount of support to us.
I guess I know that I'm assuming that the study is limited to families who have a child in Head Start.
That is correct.
But I also would assume that a lot of the results of the study you're doing could apply to a broader segment of folks in our town, many of whom are probably eligible for Head Start but don't participate. And so I guess if the data comes back and proves up that certain things result in better cognitive development or family life or whatever it does, that it's something we ought to consider scaling up outside of those families that are just participants in Head Start. Two other things. The third thing is, so I think I read that nationally Head Start children were seeing increasing gains over the last few years, and that there was some association with better professional development for the instructors, for the teachers in the classroom. Am I remembering that right? You
are remembering it correctly. Now I want to make sure I'm clear. When they are better trained, they have not been able to determine that the higher degree equals
professional development.
Right.
Basically.
So it's really the professional development, not necessarily the degree.
The degree. Right. And then the last thing is, so the pre-K instructors outside of Head Start in our city are not required to get the kind of professional development that your instructors are getting in order to see the improvement.
That's correct.
That's correct.
That's correct. But I should mention they are paid a lot more. And I think it's important to mention that because while the requirements tend to be heavier on the Head Start side, on the federal side, they don't provide the same level of funding. And I want to say this as both a thank you to you and to this team, but also to the city. We're very fortunate because our team does get the benefit of a city that does contribute to our program. So I don't ever want to, even though we're always saying, yes, we want to be included whenever there's additional dollars because they are Metro employees, I want to make sure that I'm clear that the support that we receive from the city whenever we get increases or the fact that they have Metro benefits, these are things that are very attractive to the people that we employ, and the city's support for our agency is appreciated, and it's constantly noted when we're talking to our federal partners just how much is done related to our buildings, related to the dollar supports that we receive from this city. It's extremely important.
The last thing, and I know I'm dragging this one out a little, is I know we've had discussions about the need for an additional facility in the southeast part of the county, and we've struggled, I guess, at the council level to get a consensus about where that might go. That remains the status. Is that right?
That's correct, and I want you to know that when we look at the fact that we need additional spaces out there, it's not something we're just pulling out of our heads. I mean, there is data that we have collected that shows where the demand is. Mayor, I think you're aware that we also bus children. We bus over 500 children out of their communities to our buildings in other communities. And these are 3 to 5-year-olds. And yes, our buses are secure, and yes, they're buckled in and harnessed in, actually. But it's critically important that we're able to have buildings that's near families, because as families have to make choices about how they spend their money on their gasoline, if they have to choose between getting themselves to work and getting themselves to a quality environment for their child to receive services, even though they want that for their child, they're going to choose to be able to feed their family. And so having a location in areas that's close to where the children are is extremely important.
Well, I guess I would, I don't know what progress has been made or contacts have been made with the Planning Commission, for example, to try and identify a suitable and agreeable location for that. But whatever I can do to help in that regard, I'm completely willing and ready to do. So just make sure we're in the loop in that, and we'll be glad to try and help.
Thank you.
And thank you for everything y'all are doing. You got a great board, great staff. And I remember when you came 19 years ago, I was a Metro Council member at that time. And now 20 years is coming up, but that's just the beginning, I'm pretty sure.
Oh, okay, yes.
All right. Thank you very much.
Thank you.